Hello and welcome to my talk. My name is Aoife Ni Eochaidh. I'm a chartered physiotherapist, clinical specialist, pelvic and women's and men's health physio. My practice is called International Pelvic Physiotherapy Management, and we provide a portfolio of services in the pelvic physiotherapy space. So we see patients in our clinic, in the Bonds Consultants Clinic here in Galway, and we also see patients online. We also provide online pelvic floor muscle training for patients, for men, for women. We also provide consultancy where we advise other physiotherapists, hospitals, investors, companies on aspects relating to pelvic physiotherapy. We have helped open clinics in Switzerland, Dubai, Northern Ireland, London and Scotland, and some clinics here in Ireland as well. We also provide medical legal expertise where we provide opinions and reports in relation to injury in the pelvic floor. We also provide conferencing and lecturing to doctors, nurses, physiotherapists and the general public. Now, I'm absolutely delighted to be here talking to you today about pelvic floor health, about the management of it and about the prevention of some of the problems. And I'm absolutely delighted to be here at the invitation of Galway Public Library's Healthy Ireland at Your Library series. So the men that come to see us with pelvic floor problems might be men that are after or sometimes before radical or robotic prostatectomy surgery. We might also see men with pelvic floor problems if they have a benign prostate enlargement. And we might also see some men coming to see us if they have the condition of prostatitis, which is a pain condition, and there can also be bladder and bowel symptoms as well. So the women that would come to see us with pelvic floor problems would be ladies maybe that are pregnant. They might be in the postnatal period. They might be around the time of menopause, either before or during or after menopause. It might be ladies as they get older. We might see teenagers with a thing called giggle incontinence, and we might see girls and boys from age 4 upwards with bedwetting. Now, just in today's talk, I thought I would cover a few things. So urinary incontinence is a big part of what we treat. That's a big type of pelvic floor muscle dysfunction that we see. So in today's talk, I'm going to cover pelvic floor muscle training, a thing called bladder retraining, bowel retraining. I'm going to talk a little bit about the evidence. I'm going to talk a little bit about technology in pelvic floor care, and an example is a routine which is called the home pelvic routine. I'm going to talk about lower urinary tract symptom management in men, combination therapies like medication and physiotherapy. I'm also going to talk about prevalence, how common things are, bladder diaries, a thing called electrical stimulation, and the spend and the costs of incontinence, some of the European guidelines, and I'm going to talk about some exercises, an example of pelvic floor muscle training. I'm also going to have some questions at the end. Sadly, as this is a recorded event, we won't have live questions coming in, but I've collated a few questions that we commonly get asked. So, I hope you'll find those enjoyable and that you'll learn something. Now, just a point here before we go any further. I just want to say to you that you might be surprised to hear that pelvic floor muscle dysfunction and osteoporosis are linked. So sadly, a lot of women in Ireland, the rates are as high as 1 in 2 women over the age of 50 in Ireland will have osteoporosis. And pelvic floor muscle dysfunction is linked in those patients. So just to be aware of that. Now, osteoporosis is a bone disease, and as the disease progresses, the spine in the woman mainly, though men can be affected, curves a little bit. And that curvature of the spine causes the tummy muscles to protrude and the abdomen to protrude, and that pressurizes the pelvis and the pelvic floor and can lead to pelvic floor muscle problems. And in particular, if you have osteoporosis and, for example, you're rushing to the bathroom, it's a big falls risk. So just to keep that in mind. Now, we'll talk about the men first of all, so about the prevalence. So men with urinary incontinence, which is leakage of urine from the bladder, it's as common as in 1 in 8 men. Now, bladder retraining is a treatment that is recommended that we do as pelvic physios for men with incontinence. We often say in the clinic, and we know it's reported in the evidence, that your pelvic floor muscles can actually be perfect, in good working order, but if you have poor bladder habits, then you'll still have issues. So the bladder retraining aspect of the treatment addresses the bladder muscle itself, and there's good evidence to support it. And bladder retraining will be things like teaching the person to actually fully and properly empty the bladder. And this can happen where the bladder muscle itself gets weak and the person, a man or a woman, can have trouble actually fully emptying the bladder. The bladder muscle itself will not contract and relax properly to fully empty the bladder, and that can be an issue. We also coordinate the pelvic floor muscle action with the bladder muscle in some of our training exercises, and that is, very helpful as well. We also talk about the amount of fluid to drink, how often to drink, what should the individual be having, and it can really help in men and in women with incontinence. So pelvic floor muscle training is one of the main things that we do as pelvic physiotherapists for men and women with incontinence. And pelvic floor muscle training has been well evidenced in this specialist side of physiotherapy that I work in pelvic physiotherapy. And it involves a series of exercises, different ones, targeting different aspects of the muscle function, and it's very successful. Now, pelvic floor muscle training is not a quick fix. Results do not happen overnight. I actually gave a little interview recently here in Galway on Galway Bay FM, and some of you will be familiar with Keith Finnegan. And Keith was saying to me, those exercises, Aoife, do people like doing them? Is there anything else that can be done? It must be difficult to keep them up. And, he's absolutely right in saying that, it is difficult to do pelvic floor muscle training, but it's not impossible. And they do work, and just to say that it's not a quick fix. So, if you've been given exercises before, if you've tried pelvic floor muscle training before and maybe you gave it up, you didn't find it was successful, just maybe think about revisiting it again, maybe revisiting your pelvic physiotherapist, because things have changed. We have new ways of doing things now. But just to bear in mind that particularly when you're weak, it can take some time to build up the muscle function. And our European guidelines say that it can take up to 3 to 6 months sometimes, and 6 to 9 months. And the pelvic physiotherapist will progress you through the right exercises, the right pelvic floor muscle training, to get the muscles working correctly. Now, later on, we'll be talking about an example of pelvic floor muscle training and a starting point. Just to say as well, some people that have very weak pelvic floor muscles will actually need a thing called electrical stimulation. Now, electrical stimulation is something that has been used in the specialist side of pelvic floor physio since about 1950. Now, in my clinic, I use 4 different types of electrical stimulation. And what this electrical stimulation does is it repetitively contracts and relaxes our pelvic floor muscles a high volume of times in the training session. So that has a training effect. It bulks up, thickens up, strengthens up the muscles. The second thing that it does is it stimulates the nerve supply to the muscle. And quite often, as we get older, if we've had children, the nerve function degenerates a little bit. So the electrical stimulation is good. We have good choices with that. It's around a long time. Since about 1950, there have been different types of electrical stimulation devices. Now, just to say as well, sometimes with pelvic floor muscle dysfunction, there will be other procedures that are needed, and some of those are surgical procedures. Sometimes they use bulking agents, different devices, a thing called a sling for women or for men, and sometimes for artificial sphincters are sometimes used as well. So, there are options that are available. Now, in women, just to talk about the prevalence of it, in fact, it's very common as well. Imagine 1 in 3 women suffer from urinary incontinence. And some of us think that it's even more common than that. But that's the evidence, that 1 in 3 women suffer from that. And this could be in women in the age group between 25 and 80. So there's a broad range of age groups that can be affected. You might think it's all to do with having babies, or maybe in the postnatal period, or maybe as you get older, but really anyone can have urinary incontinence and pelvic floor muscle problems at any age, whether they're a mother or whether they're not a mother. And again, you heard me talk about, the reasons that men will have issues as well. And then, as we said there, the electrical stimulation is a main treatment for women with very weak muscles, where they can't contract or relax the muscles themselves, or they can't feel them. Now, again, we have good guidelines that, advise us as pelvic physiotherapists not to overuse electrical stimulation, because it's not always indicated in every case. But it is indicated in cases when the muscles are very weak. Now, just to say, it's not an either or option. Sometimes I'm asked this in the clinic, well, if I'm having electrical stimulation, does that mean that I don't have to do my exercises, or I don't have to do my bladder retraining? So sadly, it is not an either or. You will still need to do your pelvic floor muscle training and your bladder and your bowel routines. I'll be talking further about the bowel routines. And then, as we say, the pelvic floor muscle training is well evidenced. And really, we've had new technologies as well, particularly in the diagnostic side. So tests like ultrasound scanning and MRI imaging that has helped us as pelvic physiotherapists to really know how best to provide the pelvic floor muscle training and to see how it really works. So, there's been great advances with the different technologies, both from a treatment point of view in terms of some of the electrotherapies, and both from a diagnostic point of view in finding out what's wrong and how the muscles are working. Now, so there are 2 main European guidelines that guide us as pelvic physiotherapists and as doctors and nurses that work in looking after women and men with pelvic floor problems. And they are the Continence Guideline 97 and the Continence Guideline 171. These are European, we call them the NICE guidelines. So conservative therapy is recommended as a first line for pelvic floor muscle problems. But also drug therapy or medications are sometimes indicated as well. So medications that your GP or your consultant will prescribe for you in addition to your pelvic floor muscle training or other pelvic physiotherapy that you might be having. Just to say, some of the problems that a person will have when they have pelvic floor muscle problems affecting their bladder will be that they'll have trouble with voiding or emptying, like I said earlier. They will have to strain to empty. Sometimes men and women might have to catheterize at home to fully empty their bladders. Men in particular with benign enlargement of the prostate might have a little bit of trouble getting started, some hesitancy. So these are things we think about in the clinic, but also I would urge you, to think about at home as well when you're emptying your bladder. I jokingly say to some of my patients at the clinic, if you were standing here and maybe a metre away from that wall in front of you, and if you were emptying your bladder, would your stream hit the wall? And some of the men in particular laugh when I ask them that question, and they say, what hit the wall, Aoife? It would be down the corridor much further. In that the stream is very strong and the flow is very good. Now the ladies don't seem to be as able to tell me what their flow is like, but it is a good indicator of how the bladder muscle itself is working. So again, as we train up the pelvic floor muscles, you should notice that your stream or your flow is a little bit better, and then that can be a sign that you're emptying your bladder better. So storage problems are main problems that we see in both men and women with pelvic floor muscle problems. And the storage problems would be that you haven't got control. You might have a leak, maybe with going for your walk, with coughing, with sneezing, with bending, with lifting. But there's also another type of leakage that you can have, and that's called urge incontinence. And that's where you get an overwhelming urge to empty your bladder, and the bladder starts to empty before you've actually reached the bathroom. So some patients, some men and some women will have both problems, and then we call it mixed urinary incontinence when they have that. A lot of men in particular, as they get older and as their prostates enlarge, they will have a thing called post-micturition dribble. And this is a little leakage that they have. It mightn't be, a huge amount, but it will happen after emptying their bladders. And we sort of say, anything more than a few drops is not normal after you empty your bladder. And sometimes men will describe the leakage that they have as a spoonful. But again, a spoonful can go a long way and, can create problems. So just to say that the evidence supports early pelvic floor muscle rehab in the men that sadly undergo surgery for prostate cancer. And indeed as well, some of those men will attend, certainly in Galway, a lot of them attend before they ever have their prostate cancer surgery. And this allows us as pelvic physiotherapists to pick up and identify any problems that the individual may have even before they have their surgery. And after the surgery, sadly, they'll have a catheter in place for about 10 days usually. And, that sort of knocks out the muscle action when the catheter is being used. So it's very, very important to have the pelvic floor muscle training set up and working, in that time period. So just want to talk to you now a little bit about technology in pelvic floor muscle training. And we've all seen now with the COVID-19 pandemic, the rise in technology. We see it in our own clinic. We do online consultations when we can. And really it seems to be the way healthcare is going. And this is one example from our own clinic. And it's an online way of training the pelvic floor muscles. And, we have developed this from strategies that we use in the clinic. And pelvic floor muscle training is evidence-based. We know it works. And this particular model is a little bit more affordable for people than actually coming to the clinic. And also it can be done in privacy at home, on a laptop or on a mobile phone with ease. And the videos and ebooks that are provided to guide you, whether you're a man or a woman, can be watched, over and over again. And, we see this type of technology being used in the wider physiotherapy clinics, and we just had our annual conference. The Irish Society of Chartered Physios conference just took place a couple of weeks ago, virtually online. And two of my colleagues are doing some good evidence and some good research in this area using technology in healthcare. And Dr. Dara Meldrum from Trinity College, Dublin, is looking at vestibular rehabilitation. It's a type of rehabilitation for balance disorders and disorders of the ear. And then one of my other colleagues in Royal College of Surgeons, Professor Suzanne McDonough, has been looking at using technology in stroke care. And nothing beats coming into the clinic, and definitely best practice in all areas of physiotherapy at the moment is currently, one-on-one. But the emerging evidence tells us that maybe a more blended care approach, so a mix of online and coming into the clinic, is really probably where the future is going to be in the short term. And, it's nice to see that. And I suppose it's a little bit more sustainable as well, in that, you're not driving to the clinic, you don't have to take the time off work. And particularly if you live far away from the clinic, where your pelvic physio might be located. So just, that's an example that, has grown out of COVID for us, the home pelvic routine. And, it's very popular with people. Now, moving on. So next of all, I thought I would talk to you about a particular exercise, one that you could do today or tomorrow to start to train your pelvic floor muscles. And this exercise is called the knack. Now, we have a picture of a gentleman here on his bike, but this is an exercise that would be suitable for men and for women. Even if your muscles were really weak and very weak, most people can manage to do this exercise. So it's called the knack exercise. It's an American term. One of my colleagues in the UK in America was responsible for this one. And to do the knack exercise, what you do is you tighten the back passage muscles as if you're trying to stop yourself passing wind. I want you to imagine that you're in a lift, or you're at a party or in the bar or something, and that you don't want to pass wind. I don't mind at this stage if you hold your breath. I don't mind if the tummy muscles tighten, if the back of the legs, if the buttocks tighten, if the front section of the pelvic floor tightens, we don't mind, as long as you imagine that you're trying to hold in wind. Now, we need you to do this squeezing of the back passage muscles with 100% effort. So it's a max squeeze. And we want you to do this exercise before and while lifting anything heavier than a jug kettle of water. So for example, if you were bringing the groceries in out of the boot of the car, or maybe fuel or wet baskets of laundry, that you would squeeze the back passage muscle with 100% effort. We also want you to do it if you were coughing and if you were sneezing. And we want you to try and maintain the squeeze until you put the item down, or while the cough is there, or while the sneeze is there. So for example, if you're bringing the groceries in out of the boot of the car, you would squeeze before you'd lift them, and you try and keep the squeeze on until you put the shopping down. Now, it can be difficult to maintain the squeeze until you put the item down, but you'd be surprised how little by little that you'd manage this, that it would improve. Now, if you're not lifting and not coughing and not sneezing, you don't have to do this exercise. And we've a second exercise though that you could do on a daily basis, more your sort of a regular exercise. And this second one is called the low grade knack. Now, you know what a knack is. We just talked about it. It's tightening the back passage as if you're trying to hold in wind or gas. But with the low grade knack, it's a small squeeze of the back passage. If you could squeeze by about 30% of what you could do, or about a third. We like you to do this exercise up on your feet, so in standing or in walking. And we want you to hold the squeeze for a count of 10 seconds and then relax the squeeze for 10 seconds. And repeat that until you have 3 minutes worth of it done. And if you could do that 6 times a day, it's a great start. Now, that second exercise is a little bit harder than the first one, the 100% knack, which is sort of all or nothing. Now, when the muscles are very weak, you can find it difficult to, identify, am I really squeezing at 30%? But I would suggest that you give it a go. We have to start somewhere with our training, but you will find as the weeks go on that it will get easier. Now, a lot of people ask me, what position should I be in for the 100% knack? In general, you're going to be in standing if you're lifting, but of course you could be sitting when the cough or the sneeze would hit you. So if you started with those 2 exercises this week, that would be amazing. And as I said, at this stage, don't worry if you're holding your breath. Don't worry if you feel your tummy tightening. Don't worry if you feel in women the front passage area tightening or in men the area at the back of the scrotum. That's absolutely fine. And you're probably interested to hear that we begin all of our training these days from the back passage. We know from the tests like ultrasound and MRI how important the posterior compartment is in the beginning of the training and in really getting the muscles working. And when you squeeze the back section of the pelvic floor muscles, the front come with it. So I hope that's helpful. So give it a go. Now, so supervised pelvic floor muscle training is what's recommended for men and women with stress urinary incontinence. Stress urinary incontinence is leakage of urine with coughing or sneezing or walking. Now, when we say supervised, what we mean is a series of exercises that your pelvic physiotherapist will give you and will progress you through. So it's not just, here's a sheet of paper, off you go, do these. You need to be supervised. You need to have these exercises progressed. Very important that if you're a man that has had prostate cancer surgery, that you're doing these. Very important whether you're a man or a woman, that you continue these exercises for at least 3 months or even longer, 3 to 6 months. Now, pelvic floor muscle training should be an activity of daily living. It should be a lifestyle change. Now, when you are beginning your training in the early days, getting the muscle function back, you'll have a lot more to do than you will be doing in the maintenance stage. When the muscles are working more automatically themselves, you won't have as much. But all of us, myself included, should be doing our pelvic floor muscle training daily, and start with those 2 exercises we just covered. Now, there are some other options as well. And as I said already, the guidelines are that maybe some medication could be used as well in combination with the pelvic floor muscle training for certain things. So, the GPs will prescribe alpha blockers. Tamsulosin is one name, for the benign enlargement of the prostate for the gentleman in addition to the pelvic physiotherapy. And men and women will benefit from bladder medications and pelvic floor muscle training together if they have overactive bladders and what we call urge incontinence, or they mightn't have incontinence, but they just might be going a lot and their sleep might be disturbed at night. And the hope is that we train up the pelvic floor and we train up the bladder muscle, and then after a while the person might not need the medication. But again, the medication is the remit of your GP or your consultant, maybe your urologist, your urogynecologist, or your gynecologist. Now also, of course, HRT is used widely in women around the time of menopause and the pelvic floor muscle training. So, keep that in mind. And sometimes, sadly, the medications are just not suitable. You have side effects. So again, all of that is the remit of your GP. But just bear in mind that physio works, and just to stick with it and definitely consider it as a first line. Now, moving forward. So incontinence is costly. So there was a study carried out in the NHS. This is an old study now, this is in 2000. And imagine the NHS spent 233 million on incontinence in community dwelling women. So women living in the home, in their homes, not in hospital. And also this study showed us that the individuals themselves were spending large amounts of money on managing incontinence. So 178 million was spent by individuals themselves, which is huge. People tell me in the clinic that they can sometimes spend between 5 and 10 euro a week on pads, and the spend per year can mount up to 500 euro, which is huge. Now, some of the tests that you might be sent for by your GP or your consultant if you're having pelvic floor and bladder issues could be the flow test, which we talked about in relation to emptying the bladder. Cystoscopy is a test that you might need where a camera is put into the bladder. Urodynamics is a test that you might be sent for where the activity of the bladder muscle itself is tested. It's done in men and women. And also imaging might be done. So different types of ultrasound scans and different types of MRI scans. So there are some of the tests that you might be referred for. Now, keeping a diary is sometimes recommended, that you will monitor your drinks, you will monitor what you're passing, what your volumes are like, and really the latest kind of thinking on it is that maybe those bladder diaries, that there isn't really much evidence to support it. A lot of my patients actually don't really like doing those bladder diaries, and they're a big job. If you were asked to keep a diary of everything you drink and everything you pass for 3 days, which is often asked, it's a lot to do. Just be aware as well that in 30% of men over the age of 65, that incontinence is a bother for them. Just to mention as well the bowel side of things, and anyone that comes to see us with pelvic floor muscle problems relating to their bladder function, we nearly assume that they have a bowel issue as well until we have proven otherwise. And just constipation, which is so common, causes stretching of the pelvic floor. And again, what the pelvic physiotherapist will be doing with the person to treat the bladder problems will also improve the filling, the storing and the emptying from the bowel. Of course, incontinence just isn't related just to the bladder. So you can also sadly have incontinence from the bowel side of things, and that can be stool or liquid or staining or soiling. But also it can be gas and wind that you can't control that, which is very embarrassing. And again, it can be to do with pelvic floor muscle dysfunction. So, just so much help is available by pelvic physiotherapy for these problems. And there's a lot of good evidence there from the Australian Physio Association there on the different, what we call conservative management of these problems. So just moving on now, I thought we might talk about a few different case studies, right, in relation to pelvic floor muscle problems that people might have. So this first case is about a lady who is age 60, and this lady has presented with mixed urinary incontinence. So she's having leakage with coughing and sneezing and maybe going for her walk, but she's also having a leak with the urge to empty her bladder. This lady also has what we call prolapse. Now, there are 8 different prolapses that a woman can have. The most common one is where the womb comes down in the pelvis, but also you can have a little bit of bladder prolapse or a little bit of what we call bowel prolapse, where the vaginal walls just don't hold their shape, and we call that cystocele and rectocele. And if it's the womb, we call it uterine descent. Now, a lot of ladies that come to see me are often surprised when I'm saying, oh, you have a little bit of prolapse. And they'll say, Aoife, I can't, I had a hysterectomy. But they don't realise that, as I say, more than the womb can prolapse, but so much can be done. Training the pelvic floor will really help symptoms of prolapse as well. Now, this particular lady, which is typical at this age group, your sort of postmenopausal age group, she's a very sluggish bowel. She needs to be careful with her diet. Now, she had a high body mass index. Now, just to say, if your body mass index is over 30, you are advised to lose some weight so that you won't develop prolapse. Now this lady was also what we call hypermobile, which is sort of a suppleness or an added flexibility. And again, when you're like that, about 10% of the population we think are supple, or sometimes it's called double jointed. But you'll find that the tethering or the support of their organs just isn't as good, and they're a little bit predisposed to prolapse. Now this particular lady also had the osteoporosis, but this is a common presentation that we'll see in a woman in this age group, so I suppose post-menopausal. Now the next case here that I have for you is a younger lady. Now this lady is age 25 and she's coming in with leakage, so stress urinary incontinence. She can't do her exercise without having leakage. She's also going to the bathroom very often. She can't hold very long, and also she has a leak in relation to needing to go. And this poor girl is also up 4 times at night. So her sleep is disturbed. So not only has she bladder problems daytime, she's bladder problems nighttime. And she has pain during sexual intercourse. That's what that word dyspareunia means there. She also has decreased libido with these problems. And she also has what we call vaginismus. And this is where there's a sort of a tightness in the pelvic floor muscles. So, you know, she really has a broad range of symptoms, and this is common. This woman did not have children, but just to say, there is a lot that we can do with her to train her pelvic floor muscles and to solve these problems. Now, moving on, I have another case here for you of a lady who's aged 50, and she has stress urinary incontinence with exercise. She's presenting with atrophic vaginitis, which is an estrogen problem. So this is a woman who's sort of going through the menopause or perimenopause, and she has lost bulk in her pelvic floor due to hormonal changes. And she has dyspareunia like the last lady, which is pain during sexual intercourse. She's also very supple. She's a problem with her bowel. She's not able to empty it, and she's suffering from constipation. And again, with the menopause, we can see these problems with the bowel in combination with the pelvic floor muscle problems, but so much can be done with pelvic physio is the good news. So moving on then, another case we would see is a girl who is 30, and this woman is actually a postnatal woman, and she's presenting with incontinence from the bladder with exercise, but also sadly from the bowel. And sadly, this woman also has incontinence or flatus, which means that she can't control wind or gas. She has difficulty differentiating between wind or stool. She gets the sensation that she thinks she might be about to pass wind, but actually it turns out that it was stool. Now this lady had a history of a thing called a 3rd-degree tear, which is a birth trauma injury. Sometimes a forceps is used, or it was a difficult delivery with a lot of pushing. A particular muscle in the pelvic floor called the internal anal sphincter can be damaged with a 3rd-degree tear. Now this young girl also had prolapse cystocele, so her bladder was coming down into the vaginal walls. But again, this is a common presentation in a postnatal woman, but again, training her pelvic floor into the normal range will really help. So moving on now, we have another lady, a little bit older. This lady, she's age 70, and this lady is coming to us because she has a history of reoccurring urinary tract infection. And what's happening with this lady is her pelvic floor muscles are weak and her bladder is not contracting or relaxing properly, and she's not fully emptying her bladder. And in that stagnant urine, infection is creeping in. And this particular lady has a history of long-term use of antibiotics. Now she also has some urgency issues, and she has some issue in emptying her bowel as well. Very typical of this age group. Now again, it's worth saying here, you know, none of us are getting any younger, but definitely these problems are a little bit harder to deal with as we get older. So I would urge you, if you are thinking of attending your pelvic physiotherapist, that you do so sooner rather than later. But just to say as well, a 100-year-old muscle can be trained. So it really is never too late, but the sooner you start, the better, like everything. Now this is another case here of a girl who's age 15. And this girl that attended was a very sporty girl. She was actually a great camogie player, but she had giggle incontinence. So when she was laughing with the girls, it wasn't, she was fine playing her camogie, but she had a little leak. And this girl had a terrible history of constipation, so she really had trouble emptying her bowels. This weakened her pelvic floor muscles. She had some poor bowel habits. Now, you heard me talk earlier about poor bladder habits, but really we got this girl going on good fibre intake, good fluid intake. We trained up her muscles and we sorted out her giggle incontinence. I remember this particular girl, I was saying to her afterwards, are you delighted now that you're all better? You can laugh with your friends. So she said, well, not only that, Aoife, but my poor mother had to come in to me in school and collect me and bring me home because my full uniform would have to be changed and laundered, and I'd missed so many classes. And, you know, so she was delighted that that didn't have to happen and be drawing attention to herself. Now, moving on to some of the male cases now. So we've a gentleman here who's age 10 and he's suffering from bedwetting. This fellow had poor habits. He wasn't drinking enough. He wasn't emptying. His muscles were weak and his bowel was not good. And this is very commonly seen. And he has done very well. Yeah, that little fellow, age 10. Now another fellow here, older gentleman, age 65, after prostate cancer surgery. He has some leakage. He's an ex-smoker. It left him with a cough. He had some post-op infection. He also had erectile dysfunction. So again, training the pelvic floor muscles will help bladder problems, but it will also help sexual function. So just to keep that in mind. Moving on now, here we have a study of a younger man, aged 25, with prostatitis, which can be, can be infection related or non-infection related. And symptoms can be urgency, frequency, pelvic pain, leakage, and up at night with the bladder. And we see this as well in the clinic. Now, moving on to some questions, right? So I'm frequently asked, what about the pelvic floor and menopause? What problems can arise that maybe HRT can't resolve? So there are hormonal changes that occur around the time of the menopause that affect muscle function. And though HRT will work on hormonal changes, it won't train the muscles. When you're fatigued and you have sleep disturbances during menopause, it affects muscle function. And the bladder and the bowel muscles themselves can also be affected. And sexual function can be affected with the hormonal changes, but so much can be done with it. Now, keeping your pelvic floor muscle function in the normal range is so important before, during, and after menopause. It will prevent and treat these problems of bowel, pelvic, and sexual problems, along with HRT if your doctor prescribes it for you and if it suits you. If you are a complete beginner and you don't have a clue what a pelvic floor is or where it is, can you give a brief description on where to start? So if you imagine the area of your body between your waist and the top of your legs, this is where your pelvis is located. It's a basin-shaped bony structure. Your tummy muscle is where your core is located. And think of the pelvic floor muscles as forming the base of the pelvic basin. They are really the underneath part of your core. The pelvic floor muscles holds up or support your organs correctly in the pelvic cavity. And these organs are your bladder, your bowel, and in ladies, your vaginal walls and your womb. Another question I'm asked is how important are these muscles? Well, they're really important because I think they're some of the most important muscles in the body because they're responsible for the normal filling, storing, and emptying of the bladder and the bowels. And they're so important for normal sexual function as well, and also to guard against prolapse. If the pelvic floor muscles are not in the normal range of function, then our bladder and our bowel may not fill and store and empty urine, or wee, or stool, or poo correctly. And if we're not eliminating our waste material, our wee and our poo correctly, we can become unwell with urinary tract infection or obstructed bowel or constipation. And why are they important? Because, when our bladders and bowels, are working correctly, our quality of life is good. If we have problems like this, we can't live our lives, go to work, travel, if we need the bathroom urgently, and we just won't feel well in ourselves. Our energy levels will be poor and we will feel anxious. How long can it take to see benefits? So in a week, you will see improvements of training your pelvic floor, but it can take a little bit longer. Like I said earlier, the nice guidelines are that it can take 3 to 6 months to fully train the pelvic floor. You need to keep them up for life at a maintenance level. What issue can pelvic floor muscle problems pose for menopausal women and sexual intercourse? Well, the pelvic floor muscle dysfunction can affect menopausal women from a pain point of view, from a climax point of view, and from an arousal side of things. Many people think it's just women that have a pelvic floor. There are many benefits from men having a strong pelvic floor too. And men need to train their pelvic floors for exactly the same reasons as women. Men too, unfortunately, get the same bladder, bowel and sexual dysfunctions as women. Now, thank you so much for the invitation to speak this evening on behalf of the Galway Public Libraries and Healthy Ireland at Your Library series. I'd like to particularly thank Colette Dempsey and Caroline Rowan, who've linked with me in bringing this talk to you this evening. I hope you enjoyed it. You can contact me here, aoife@ippm.ie, if you have any queries for me. And the online courses I was talking about there, you might be interested in looking at those, and you can see those on courses.homepelvicroutines.com. I hope you enjoyed the talk and that you learnt a little bit. And don't forget to train your pelvic floor muscles. Thank you.